Hello, my name is Dr. Michael Gorman. I'm the founder of Telehealth PT. I'm a fellowship trained physical therapist. Today we're going to talk about why won't my pain stop? I want you just to think about a scenario. Let's say, for example, you've never had pain a day in your life, never had neck pain a day in your life. Having a great day. You're driving around, you're stopped at a stoplight. And then all of a sudden, out of nowhere, a car rear ends you, a car going about 35 miles an hour, totally unexpected. Well, that day you're sore. The following day, you're having a lot of pain. For about 2 weeks, you're having significant pain and a lack of movement. Up till about 3 months or so, you're at post the injury, you're still really hurting. Begins to subside, but even after a year, you're still not back to where you were. So why does this happen? What causes this chronic pain? I want to take just a couple of minutes to explain this to you because as a physical therapist, my number one job is to educate every patient that I have the opportunity to treat. And as you all know, the opioid epidemic has been a huge part of our culture now for several years. And we need to educate people on causes of pain and what they can do to decrease their pain so we can catch them before they get to the stage where they fall into the spiral of an opioid epidemic. In 2020, over 115 people a day are expected to die from an opioid epidemic. That's over 40,000 people a year. That is why this education over the next couple minutes is so important. So why do we have pain? Well, we have pain because it's your body's way to protect you. You see, pain occurs when there's been some type of physical trauma to a tissue or tissues in our body. When something gets overstretched, I use the example of a finger. I'm going to put my hand on my right index finger. I'm going to push that index finger down. At some point in time, I'm going to start having pain, which is a very good thing. If I did not feel this, I would be causing damage to my tissue because my body, my brain would not be aware of what's going on. So our pain is a sensation. It's an unpleasant sensation that is your body's way of protecting you. When injury happens, this is a scenario. So at the top of this circle, this is where your injury occurs. After the injury occurs, you will start to experience pain. As the pain continues very quickly, you'll get what we call muscle guarding, which is just a reflexive contraction of the muscle. Again, your body's way of trying to protect you. As that continues, very shortly after, you're going to start to have that muscle guarding or tightness. It's going to go into a cramp or muscle spasm, and the inflammation cycle begins. And this happens very quickly after any type of trauma. With the muscle spasm and inflammation, we have restricted movement. With restricted movement, we have muscle weakness and loss of normal function. So we get a double whammy of restricted movement and muscle weakness. So our body stiffens up and we lose muscle strength very, very quickly within 24 to 48 hours. As we begin to lose our function, it starts to have a huge, huge, huge psychological impact on us. Okay. So with keeping that in mind, why then does chronic pain exist? In theory, a body's tissue heals maybe within a month. It totally depends upon the level of trauma and the health of the individual. But why would pain go into a chronic state, which we consider chronic to be more 3 to 6 months or more of pain. Well, several things factor into that. One's general emotional state. If you're going through a tough time in life, if you're going through fighting depression, if you have a lot of anxiety, all these things will can feed into a chronic pain state. What's your reaction to pain? Some people have no issue with dealing with some pain and they just get over it. Some people, though, are highly reactive to any type of pain. What's your overall health like? What is your nutritional status like? What are your sleeping patterns like? All these things factor into tissue healing. And the longer it takes for a tissue to heal, the more likely you're to go into a chronic state. But really what happens is after a given period of time, we develop what's called central sensitization. That is essentially where the nervous system gets wound up. I say it gets on edge. Things that typically wouldn't bother it, all of a sudden do when the central nervous system and nervous system called your sympathetic nervous system gets in a ramped up state. This happens frequently, and unfortunately, so many people think they either have to live with this pain or there is no hope. Well, I have to tell you that there's a lot of hope. And I'm going to sit here and tell you that physical therapy, skilled physical therapy, in the hands of a knowledgeable physical therapist is your best option. My next video, I'm going to tell you that. I'm going to tell you 3 reasons why physical therapy in the hands of a trained clinician is the best way to help to decrease chronic pain and keep you out of the opioid epidemic. Thank you for your time. If you have questions, if you want to reach out to me, please email me at mgorman@imovetelept.com or go to my website, imovetelept.com. Thank you.